I'm Tim McGonigal in Great Falls. According to the Department of Veterans Affairs, about 6% of the U.S. population will have post-traumatic stress disorder at some point in their lives. And about 15 million adults have PTSD during a given year. About 8% of women develop PTSD sometime in their lives, compared with about 4% of men. A Great Falls doctor has made lowering those numbers her mission, and her treatment method is being met with amazing success.
A year ago, if you fit me at the vet center, I would be sitting in the corner all by myself, having people stay away from me.
I was in the hospital many times. I was having severe panic attacks. I couldn't function.
Veterans Frank Morazan and Jeremiah Scott are among the millions of Americans diagnosed with post-traumatic stress disorder, or PTSD. Like a growing number of people, they're benefiting from a treatment called stellate ganglion block, or SGB.
So your stellate ganglion block is otherwise known as your cervical sympathetic plexus, and it's a driver of your fight and flight system.
Using ultrasound guidance, Dr. Katrina Lewis injects the medicine into the stellate ganglion.
The only part that is slightly uncomfortable is where I numb the skin and this muscles.
Dr. Lewis has been in the medical field for more than 33 years and has treated more than 400 patients with SGB therapy since 2017. For most patients, the results are immediate.
Even at my first block, I realized that I had a lot of noise going on in my head. Maybe racing thoughts, ideas, and things that were constantly moving. And once I had the block, everything just stopped, and everything came down to where I could focus on everything.
Jeremiah, an Air Force veteran of more than 21 years who witnessed combat in Afghanistan, has had 6 shots plus a booster. Dr. Lewis says the treatment for everyone is different depending on the trauma. And it's not just soldiers who suffer from PTSD. Jennifer Banks is Dr. Lewis's assistant. She's also a patient who endured a physically and emotionally abusive relationship.
After just my second injection, I was on 3 medications for anxiety, and after the second, I came off all of my medications. And
Dr. Lewis believes in the science and stands behind the results.
My nurse and I would often burst into tears because it was so amazing to see a patient just, tears of joy streaming down the face or just smiling from ear to ear. And yet that person initially coming in the room was just completely flat, depressed.
For Frank, an indigenous American who spent 2 years in Thailand in the Vietnam era before sustaining a brain injury in a motorcycle crash, the treatments have been a lifesaver.
I've been suffering with this for 44 years, and there's been a couple times where I thought I couldn't go any further. She has saved my life.
It's been the most fulfilling thing I've ever done as a physician.
Dr. Lewis says the procedure itself is covered by insurances, but when combined with psychological diagnoses, most insurances consider it an experimental treatment. She says almost half the VA facilities across the state are paying for it, but not yet in Montana. You can see extended interviews with Dr. Lewis, Jeremiah, and Frank on our website.